reported a record single-day high of new COVID cases. And not just in Ontario, but in many parts of the country, ICU beds in hospitals are filling up, and the patients in them are younger and younger. This is not the place anyone wanted to be right now, because when hospitals fill up, it puts pressure on nurses, doctors, and all healthcare workers. And it means that operations or treatments have to be cancelled or postponed, like for people who are waiting for cancer surgery. We're not out of the woods yet with this virus. Everyone is working around the clock to get as many Canadians vaccinated as quickly as possible. But right now, more contagious and dangerous variants are spreading and threatening the progress we've made. Even with millions of Canadians already having received their first dose, we need to keep doing what we know works to stop the spread of the virus. So avoid gatherings, stay home when you can, wear a mask, keep your distance, and download and use the COVID Alert app. We know what it takes to stop this wave. We know how to get out of it. We've done it before. We just need to hang in there, be careful, and protect our loved ones, protect our essential workers, do the right thing so we can get to a summer that is better than right now. Today, I also want to address teachers, parents, and kids across the country. Yesterday, Premier Ford announced that schools will close in-person learning indefinitely as cases of COVID-19 rise sharply in Ontario. And we know that other provinces are watching the situation in their schools, too. I know this isn't easy. So to teachers, parents, and kids, thank you for your efforts once again. You are stepping up in incredible ways, and I know it's tough. Nobody wants to go back to online learning. Nobody wants to be stuck at home. But we have to make it through this, and things will get better because of what we're all doing right now. Since the beginning of the crisis, we've invested $2 billion through the Safe Return to Class Fund to help provinces and territories make your schools safer. And we will continue to do whatever it takes for as long as it takes to get us through this. Jusqu'à maintenant, on a livré plus de 11.3 millions
more than 11.3 million doses of COVID-19 vaccine have been delivered to the provinces and territories. Pfizer, as planned, we've received just over 1 million doses of the Pfizer. As for Moderna, a shipment of 850,000 doses arrived in Canada this morning. Vaccination is progressing every day. More and more people are receiving their doses, but that doesn't mean we can't continue to protect each other by following public health advice. With these variants, the cases in this third wave are spreading very quickly. We're all tired of COVID-19. With the events of the last few nights in Montreal and elsewhere in the country, we can see that there are people who are increasingly frustrated, but so long as we are not following public health advice, we're only prolonging the situation, and we want to get out of this third wave. Everyone wants to exit the third wave as soon as possible. We need to continue our efforts to save lives, to help our healthcare workers who are overwhelmed. Just a few more weeks of following the public health advice, guidelines, being very careful, and then we can have a hope for a much better summer. But as you know, the cases we're dealing with today are based on the actions we took a week or 2 weeks ago. And if we want to see a decrease, a drop in the number of cases, so in 2 weeks, we need to do the right thing today. Vaccines are coming, but we need to reduce cases. By the end of June, we will have received 44 million doses of vaccines. This is not the time to give up. flattening the curve. Since the beginning of the crisis, we've often talked about essential workers, whether in our hospitals, schools, or elsewhere. As we said earlier, these workers are making incredible efforts. And when we talk about essential work, well, that, of course, also includes the crucial work of our farmers who allow us to put quality food on our tables. One of the things that the pandemic has shown is how important it is to have a strong and resilient agricultural sector. As we continue to work on economic recovery, we want to ensure that Canada's supply-managed producers have the tools they need to succeed.
Thousands of poultry and egg farms in Canada. A lot of them are owned by families. Last year, we promised those families that we would invest over $690 million over 10 years to provide full and fair compensation to Canada's chicken, turkey, and egg farmers following the CPTPP trade agreement. Later today, Minister Bibeau will share details about how this funding will help producers invest to modernize their farms and how it will help promote Canadian-made products here at home. But the bottom line is this: our government will always be there for Canadian farmers. So to farmers, thank you for your incredibly hard work. You stepped up during this pandemic to get good food on our plates. Through this pandemic and beyond, we've got your back. Together, we'll continue to build a sustainable future for rural farm families and for all the Canadians who rely on you every single day. Anyone who's seen the endless miles of wheat and canola as they drive across the country can tell you just how big Canada is. In a country like ours, air travel is an essential service. On that front, yesterday, Deputy Prime Minister Freeland and Minister Alghabra announced that we've reached an agreement with Air Canada to secure air travel for Canadians for the future. The conditions for Air Canada to receive this support are very clear. They will ensure that regional communities have air connections to the rest of Canada. They will refund their customers for pandemic-related cancellations. They will commit to protect jobs, pensions, and collective agreements. And they will restrict executive compensation, buy back shares, and dividends. Air Canada will also have to demonstrate how they will support environmental sustainability and national climate goals. The deal is a good and fair deal in the interests of jobs, workers, communities, and customers. L'entente annoncée hier avec Air Canada.
Yesterday's agreement with Air Canada will protect jobs, keep our communities connected, and ensure that passengers are refunded. The airline industry is a strategic sector for our economy, and our negotiations with other airlines are ongoing. As always, we will ensure that the interests of Canadians and workers are at the heart of everything we do.
This past year has been tough. There have been a lot of special moments and celebrations that have been done differently. Yesterday, I had the chance to speak virtually with Sikh healthcare professionals from across Canada to celebrate Vaisakhi and Sikh Heritage Month and to thank them for everything they do. Happy Vaisakhi to everyone celebrating. This week also marks the start of Ramadan. I want to take this opportunity to thank the many Muslim Canadians who continue to work hard on the front lines and the many others who are helping their neighbors and communities during these difficult times. Cette année encore, le Ramadan.
This year, Ramadan will be different again. It will involve virtual means of gathering online rather than in person. But one thing is for sure, the pandemic will not stop us from celebrating the values of gratitude, compassion, and generosity that are at the heart of Muslim communities and that are shared by Canadians from all walks of life. Ramadan Mubarak. Thank you. I will now turn the floor over to Dr. Tam.
Teresa, I think you just received your vaccine as well. That's good news.
Bonjour à toutes et à tous. As we continue to track current surveillance data against the longer-range modeling forecast from just over 2 weeks ago, we are seeing daily cases still rising along a strong resurgence trajectory. Although COVID-19 vaccine benefits are being seen for high-risk groups prioritized during the initial rollout, experience worldwide is unequivocal in cautioning us that strict public health measures will continue to be crucial during this phase of vaccine rollout, especially in the presence of high rates of disease. To date, over 1,071,000 cases of COVID-19, including over 23,350 deaths, have been reported in Canada. Over the past week, there has been a 33% rise in daily case counts, with an average of almost 8,100 new cases reported daily. During the same time, the number of people experiencing severe and critical illness continues to rise. On average, over 3,000 people with COVID-19 were being treated in our hospitals each day, representing a 29% increase over last week. This includes almost 970 people being treated in intensive care units, which is a 24% higher than last week. Although the number of deaths has averaged around 30 each day for several weeks, there is concern that if the increase in severe illnesses persists, we could see a gradual increase in the mortality trend, with today's average at 34 deaths daily over the past week. Today's average at 34 deaths daily over the past week. There are almost 36,000 variants of concern cases reporting to date across Canada, with the B117 variant accounting for over 96% of these. These trends are discouraging, but they reinforce why we must strengthen precautions to bring this variant of concern-driven resurgence under control quickly. This is the third big push, and we're all tired, but the benefits of applying our strongest collective effort by following public health advice and strictly maintaining individual precautions could not be greater. This push will enable us to focus more capacity towards vaccine rollout. Two great examples of this unified effort I will highlight today are from Nova Scotia. We have recently learned of a vaccine clinic organized for Black Nova Scotians in the Hammonds Plains community, just outside of Halifax. The clinic was held at the historic Emmanuel Baptist Church, which has long been an important fixture in the community. Coming together in solidarity to receive COVID-19 vaccines is a testimony to the community's perseverance and commitment to ensuring people feel culturally safe in the vaccination process. I also heard about a pharmacist in Cape Breton who converted an old ambulance into a mobile clinic to bring COVID-19 vaccination to seniors and people with mobility challenges. There are so many examples from individuals to organizations finding ways to help others and make sure that we all end this crisis together, stronger and more united. Finally, on our current trajectory, it might seem premature to think of the days when restrictions will ease and social and economic activities will resume. But if we want to take forward the things we've learned about the importance of family, community, and equity, about how we supported each other, adapted, and innovated, we must commit to acting thoughtfully, clear in the view of what we want to take forward. The end of this crisis will be a time of great change. Let's not race towards the finish and risk stumbling along the way. Let's make every step count by continuing at pace together. Thank you.
Bonjour à toutes et à tous. Alors que nous continuons d'assurer le suivi des données de surveillance actuelles,
as we continue to track current surveillance data against the longer-range modeling forecast from just over 2 weeks ago, we are seeing daily cases still rising along a strong resurgence trajectory. Although COVID-19 vaccine benefits are being seen for high-risk groups prioritized during the initial rollout, experience worldwide is unequivocal in cautioning us that strict public health measures will continue to be crucial during this phase of vaccine rollout, especially in the presence of high rates of disease. To date, over 1,071,000 cases of COVID-19, including over 23,350 deaths, have been reported in Canada. Over the past week, there has been a 33% rise in daily case counts, with an average of almost 8,100 new cases reported daily. During the same time, the number of people experiencing severe and critical illness continues to rise. On average, over 3,000 people with COVID-19 were being treated in our hospitals each day, representing a 29% increase over last week. This includes almost 970 people being treated in intensive care units, which is 24% higher than last week. Although the number of deaths has averaged around 30 each day for several weeks, there is a concern that if the increase in severe illnesses persists, we could see a gradual increase in the mortality trend. To today's average at 34 deaths daily over the past week. There are almost 36,000 variant of concern cases reported to date across Canada, with the B117 variant accounting for over 96% of these. These trends are discouraging, but they reinforce why we must strengthen precautions to bring this variant of concern-driven resurgence under control quickly. This is the third big push, and we're all tired. But the benefits of applying our strongest collective effort by following public health advice and strictly maintaining individual precautions could not be greater. This push will enable us to focus more capacity towards vaccine rollout. Two great examples of this unified effort I will highlight today are from Nova Scotia. We have recently learned of a vaccine clinic organized for Black Nova Scotians in the Hammonds Plains community just outside of Halifax. The clinic was held at the historic Emmanuel Baptist Church, which has long been an important fixture in the community. Coming together in solidarity to receive COVID-19 vaccines is a testimony to the community's perseverance and commitment to ensuring people feel culturally safe in the vaccination process. I also heard about a pharmacist in Cape Breton who converted an old ambulance into a mobile clinic to bring COVID-19 vaccination to seniors and people with mobility challenges. There are so many examples, from individuals to organizations, finding ways to help others and make sure that we all end this crisis together, stronger and more united. Finally, on our current trajectory, it might seem premature to think of the days when restrictions will ease and social and economic activities will resume. But if we want to take forward the things we've learned about the importance of family, community, and equity, about how we supported each other, adapted and innovated, we must commit to acting thoughtfully, clear in the view of what we want to take forward. The end of this crisis will be a time of great change. Let's not race toward the finish and risk stumbling along the way. Let's make every step count by continuing at pace together. Thank you.
Thank you, Dr. New. The PM will be answering questions for 20 minutes. Minister LeBlanc and doctors will remain available for more questions for another 15 minutes afterwards. One question, one follow-up, starting with the phone. Merci beaucoup, Dr. New. Le Premier ministre va répondre aux questions pendant 20 minutes et doit nous quitter par la suite. Le ministre Leblanc et les docteurs répondront à d'autres questions par la suite pour un total de 15 minutes. Une question, une sous-question, en commençant par le téléphone. Opérateur, c'est à vous.
Merci. Thank you. Please press star 1 if you have a question. Veuillez appuyer sur étoile 1 pour poser une question. Notre première question est de l'inaudible de la presse canadienne. À vous la parole. Please go ahead.
Oui, bonjour.
Hello. I'd like to know whether the most recent Johnson & Johnson vaccine developments have any effect on our intent to still receive those doses that we are expecting, or would we postpone? Answer. We're expecting to receive our first doses of Johnson & Johnson by the end of April, but of course, we will continue to closely monitor what's happening in the U.S. with their experience. We are still having discussions with the company, ongoing discussions, and we're comparing our data with all of our partners. But Health Canada will always make the right decisions to ensure the safety of everyone. This is also an example of why it's a good thing that we have such a variety of contracts with so many different contracts with such a variety of companies. Even without the Johnson & Johnson vaccine, we'll have more than 44 million doses by the end of June. It's important to have some options, and that's exactly what we have.
Donc, si je comprends bien,
I'll answer that in English now.
We are still on track to receiving our first shipment of the Johnson & Johnson Janssen vaccine by the end of this month. But obviously, we're following closely developments in the United States, and we can assure everyone that Health Canada will, every step of the way, put the health of Canadians first and foremost in any decisions we make around distributing vaccines. But it also goes to highlight that it was important that we signed deals with a large range of potential vaccine makers because we didn't know which ones would be most effective, which ones would arrive early. That's why Canadians are well served, and even without the Johnson & Johnson vaccine, we are going to be receiving over 44 million doses by the end of June.
En suivi, Lina?
merci.
Thank you.
Donc, dommage que Mme Manan ne soit
Question.
pas là, mais
Too bad Minister Anand is not here, but from what I gather, we won't change the contract. We will still be purchasing those millions of doses of Johnson & Johnson and then deciding after the fact whether or not they will be administered if there's a problem. Answer. We've signed contracts with 7 companies throughout the world. That's something we did last year precisely to make sure that regardless of the company actually delivering the best vaccine or an effective vaccine quickly, we would be in a good position either way. So yes, we have a contract. We have purchased doses from Johnson & Johnson, and we hope these will be doses we can use to protect Canadians from COVID-19. But we will be making those decisions based on recommendations from Health Canada, based on what they will conclude on the basis of what they're seeing the world over.
Merci. Our next question is from Ryan Tumulty from the National Post. Please go ahead. À vous la parole.
Yeah, good morning, sir. I'm wondering, obviously with the benefit of hindsight, but, we're in the middle of this third wave now, and vaccines wouldn't solve it, but they certainly do some way to help address its impact. Is there anything about our vaccine procurement approach as a country that you, in retrospect, now think was a mistake, or where you would have liked to have acted earlier?
No, not in terms of our vaccine rollout. Obviously, we worked extremely hard from last summer onwards to sign many different contracts with different potential vaccine makers around the world. And we were among the first countries to start getting approved vaccines into arms back in December. We've seen various vaccine companies challenged with development or manufacturing issues. But in general, the vaccines have been arriving in Canada in steadily increasing numbers. And I think it's important to remember that vaccination alone, even being well advanced in vaccinations, doesn't necessarily lead to an ability to ease public restrictions. Just look at the case of the UK, where they obviously have a higher rate of vaccination than we have. But they also have significant restrictions and have kept them in place for quite a long time. What we need in order to ease restrictions in this country as we get closer to the summer is both for more people to get vaccinated and for the caseloads to go down across the country. Those are the two things we need to make sure happens. And restricting caseloads or reducing caseloads has to do with following public health advice, restricting our movement, limiting gatherings, wearing a mask, washing your hands, doing all those things that we know will reduce the number of cases around the country, because we've succeeded in doing it before in the second wave and way back in the first wave as well.
Following up, Ryan?
Yeah, sir. The third wave that we're seeing now is worse than it has been at any point during the pandemic for some parts of the country. I'm wondering if now, especially as these cases continue to rise, if you're considering any tighter restrictions from the federal level, either restrictions between travel at provinces or maybe more restrictions on incoming travel from overseas.
On incoming travel from overseas, we already have some of the strongest restrictions in the world and have had those in place since last March for well over a year now. The 2-week mandatory quarantine on essential travelers, the limits on non-essential travel, now the testing, the pre-boarding testing, the on-arrival testing, the mandatory quarantine while we're waiting for the results of the tests, and the 2-week quarantine in a safe situation at home are all things that have meant extremely limited importation of the virus from overseas. Unfortunately, we're still getting a lot of transmission inside the country, and that is something that we need to continue to monitor. But that's not something that the federal government needs to step up on. The extraordinarily successful example of the Atlantic bubble, for example, was done without the federal government dictating to the Atlantic provinces that they needed to do this. They made that decision on their own, and it was the right one. And of course, as a federal government, we supported them. Similar things for the Northern Territories. We are there to support the provinces as they make difficult decisions on restrictions. And part of why we're making those decisions easier is by providing unprecedented supports for small businesses, for workers, for families, for seniors, for young people, to make sure that people can stay home and stay safe, if it's at all possible, to keep those essential workers safer.
Merci. Opératrice, une dernière question au téléphone, s'il vous plaît.
Thank you. Notre prochaine question est de Marie Vastel du Devoir. À vous la parole.
Last question, Marie Vastel du Devoir, over the phone. Yes, actually, I had a question about the Johnson & Johnson vaccine and the use that was suspended of this vaccine in the U.S. I actually would like to get some specifics from Dr. Tam on this one. Did the American authorities' decision, or rather, is that something that Health Canada could do? Is Health Canada considering suspending or stopping the use of the Johnson & Johnson vaccine? And could that mean that it would delay our own use of this vaccine? And we, I think, are expecting doses within 2 weeks. This is Dr. New. Perhaps I can start, and then Dr. Tam may have something to add to it. Yes, we know that our colleagues at Health Canada are independent. They are closely monitoring the situation, and they're having good conversations with their counterparts in the United States. And there will be analyzing the data. They will be making a decision as to what matters in the Canadian context. So they're currently working on this, and it's not up to us at the Canada Public Health Agency to comment on the work of Health Canada.
Dr. Tim,
This is Dr. Tam. As you've seen, Health Canada has a very rigorous process that it follows, and it will follow the same process. The sound is cutting out for the interpreter.
If you want, Dr. Tam, I'm sorry I asked it in French, but you can go in English.
Thank you. It's okay. So I think you have seen the process once already, that the regulator in Health Canada follows when there is a signal of an adverse effect following immunization with the AstraZeneca vaccine. So I expect them to do the same due diligence connecting to the international regulatory authorities like the Food and Drugs Administration in the United States and gather information from them as well as the manufacturer. We've heard about the rare side effects. I think it's 6 cases of these unusual blood clots with low platelets following 6.8 million doses administered in the United States. Health Canada, we need all of this data and do, in the Canadian context, the benefit and risk analysis. Following that, I expect that the National Advisory Committee on Immunization, as appropriate, will look at that information as it supports the provinces and territories in providing guidance. And I would also expect to convene and support a discussion amongst provinces and territories as to how best use the Janssen vaccine in the Canadian context. So all those steps I expect will be followed similar to the AstraZeneca vaccine.
En suivi, Marie?
Well, thank you. Just a quick follow-up, Dr. Tam. When do you expect Health Canada to have done this analysis and come out with an opinion on this? Et Monsieur Trudeau, en sous-question, on voit que la France suspend tous ses vols avec le Brésil parce que la pandémie.
France has decided to suspend all flights to Brazil because the pandemic is out of control there. I know Canadians should not be traveling. It is not the time to travel. So I know that. But do you intend to ask for a stoppage of any flights to Brazil for Canada? And are you considering doing the same thing with other countries? Answer. We are closely monitoring what's happening internationally. We will be making decisions as more information becomes available. We have already restricted a number of many international flights, and we have extremely rigorous methods here at our border to make sure we do not import the virus from anywhere, because the Brazilian variant is not only located in Brazil, we already have some cases here in Canada. Everything we are currently doing is indeed to limit transmission. So not only is this not the time, it's not the time to travel internationally, it's not really a time to be traveling within our country either. So be careful. For another few weeks, we will continue to be monitoring this. We'll continue to monitor the situation. Now, questions in the room.
That's available. I'm wondering what you say to Canadians who are at a higher risk of blood clots or who have other complications that may prevent them from getting vaccinated. Is that still the right messaging around vaccine hesitancy when many Canadians have legitimate questions about in the face of conflicting information?
Medical professionals, whether it's your family doctor, whether it's your pharmacist, whether it's the National Guidelines Committee, NACI, are making recommendations around which vaccines are right for which people. That means that gets translated into whichever vaccine you are offered is going to be the right one for you.
I'd like to hear what you have to say about the situation at Laurentian University. We heard that the French programs have been hard hit. First of all, what do you think of that? And second, are you prepared to pick up the phone and put some pressure? Are you prepared to provide some financial support to get those programs back up and running? Answer, we are very concerned by the situation at Laurentian University. The Francophone community in Ontario, rightly so, has every reason to be very proud of this post-secondary, the Francophone post-secondary institutions throughout the province, and we will be closely monitoring what's happening there. I can assure you that Minister Joly is in contact with her counterpart within the Ontario government to see what their plan is to protect this important institution. And yes, the federal government will be there to provide support, but it's up to the province to establish the process. We will be there, as we've been there with respect to the Francophone University in Ontario a few years ago. We'll be there.
Obviously, I'm very concerned with what has happened, the reports of what is going on at Laurentian University. Our Francophone institutions, particularly for minority communities like Franco-Ontarians, are extremely important that we protect. I can assure you that Minister Joly, the Minister of Official Languages, has reached out to her counterpart in the Ford government, in the Ontario government, to see what their plan is to support and protect this institution. The federal government will be there to support, but it is a provincial jurisdiction, and therefore they need to figure out what the plan is, and we will be there to support because we know how important it is to protect official language minorities across the country.
J'aimerais vous entendre sur le Grand Prix de F1 à Montréal.
To hear what you have to say about the Formula One Grand Prix in Montreal, about the actual event being held, but then the provincial governments are asking for $6 million in compensation or support. Are you open to providing this support? Tourism industry has been hard hit. I'd like to hear about what you have to say to this. Answer, I know that discussions are underway right now, but at every step in the process, our focus will be on the health of Canadians, and we'll be making decisions on that basis. Question inaudible in the room? The discussions are ongoing, and we'll see what we can do to protect the health of Canadians. Thank you. Next question.
And Prime Minister, this weekend your party overwhelmingly endorsed the idea of implementing a universal basic income. Today you're meeting with the leaders of the NDP and the Green parties, who also both strongly support that idea. You seem less enthusiastic yourself. Can you clarify your position on this? And as you bring in the federal budget, are you going to take the first steps, or is it something you're going to push off to your next mandate?
I know people are eager to find out what's in the budget, but they're going to have to wait until next Monday for us to put forward an ambitious budget for this country that is going to be focused on jobs and growth and building back better, even as we get through these hopefully final stages of the pandemic. I was incredibly pleased to see Liberals gathering virtually from across the country to talk about what building back better looks like, how we can create good jobs and growth, protect the environment, and support the most vulnerable around the country that we've seen have been particularly hard hit by the pandemic. The Liberal Party conventions have been a source of ideas and initiatives that often have made it into platforms and into policy by the Liberal government. I can think of same-sex marriage. I can think of a range of issues that have been brought forward, and we will continue to listen to the grassroots and value their encouragements to continue pursuing various policy options. The things that we've done for the most vulnerable Canadians, whether it's been supporting the middle class and people working hard to join it with things like the Canada Child Benefit, support for seniors by increasing the guaranteed income supplement, reducing taxes on the middle class and raising them the wealthiest 1%, are all things designed to make sure that everyone has a real and fair shot to succeed. And that's exactly what we're going to continue to work on as a party.
Prochaine question.
Hi, David Thurton, CBC News. Prime Minister, you had a lot to say about all the work that your government has been doing during this pandemic to provide benefits for Canadians. But the Bloc and even the NDP is saying that you wouldn't have been so generous had it not been for them pushing you, and that you would have done the minimum to help Canadians. Do you agree with that?
It is the role of political parties to try and make themselves look as good as they can. And as relevant as they can. It is the role of a government to be there to support Canadians. And I made a very straightforward promise at the beginning of this pandemic that we would have people's backs, that we would be there for Canadians as much as it took, for as long as it took to get through this pandemic. Not just because it's the right thing to do morally to be there for each other, but also because it is the smart thing to do to ensure that our economy can come roaring back as quickly as possible after this pandemic. And this is about us as a government being true to the values and the principles that we have led with over the past 5 years. Whether it was the very first thing we did was lower taxes for the middle class and raise them on the wealthiest 1%. Whether it was the fact that we moved forward with the Canada Child Benefit that lifted hundreds of thousands of kids out of poverty and has made a huge difference in the lives of Canadians. The NDP voted against the Canada Child Benefit. We've continued to move forward on lifting seniors out of poverty. We lifted over 1 million Canadians out of poverty in the first 5 years of our government, at the same time as we created 1 million jobs. The focus we have as a government is on growing the economy and creating opportunities for Canadians, but we know the best way to do that is to make sure that those opportunities are there for everyone. So I'm always happy to see the NDP and the Bloc and the Greens and others supporting the strong measures that we're putting forward. I'm always happy to disagree with the Conservatives when they say that we should have done less for people and more for businesses, because investing in people is something that has demonstrated positive results, not just for Canadians across the country, but for our economy as well, before this pandemic and through this pandemic.
We'll take one last question on the phone. On the floor, please.
Hi, Prime Minister. Chris Reynolds, Canadian Press. Bill C-19, the legislation that would amend the Canada Elections Act to allow a federal election to play out safely and smoothly during a pandemic. This bill has not yet passed second reading in the House of Commons. I'm wondering if you will commit here today to not ask to dissolve Parliament until that legislation is passed, or otherwise trigger an election.
As I've said many times, our priority as a government is being there to support Canadians, being there to give them the supports that they need to get through this. A great example of that is the fall economic statement that put forward significant measures to support Canadian families and workers through this difficult time. Unfortunately, the Conservative Party, amongst others, have been blocking this piece of legislation and preventing that help from getting out to Canadians. That's really disappointing. We need to have a government and a parliament that functions to deliver the supports to Canadians they have, not to have parties play political games. So we're going to stay focused on making sure that Parliament is working for Canadians. And part of that is ensuring that we do move forward on important initiatives like the C-19, the Pandemic Safe Elections Act, which would allow for a federal election to be safer in a pandemic situation. Obviously, nobody wants to have an election right now. Certainly we do not. But I think it is simply responsible to make sure that parties have the choice, for example, to vote against the budget we're putting forward next week. And not feel threatened that democracy is so fragile that we can't have an election because they would be putting Canadians at risk. That's why we're disappointed that even though we've brought forward, I think 5 different times, if not more, the Elections Act for debate, it hasn't been able to move forward. We hope that parties are going to put aside their political differences and allow debate and discussion to happen at committee on the Elections Act. Because we need to have a parliament that functions, but first and foremost, we need to be delivering for Canadians as we're in this third wave, and we're going to do everything we need to get Canadians the support they have to have while we bring forward a budget, while we move forward on direct supports for Canadians. Depuis les débuts.
From the very start, I made a promise that we would be here for Canadians for as long as it takes and with all the resources required, that we would get through this period. In order for that to happen, we need to deliver within the House of Commons. We have to deliver on our promises within the House of Commons, promises to Canadians. Unfortunately, the fall economic update has been stalled numerous times by the Conservative Party that is blocking support to Canadians. It is disappointing that they should be playing political games with such important issues for Canadians. Our priority is to make sure that we are here to support Canadians. The other political parties are playing political games from time to time. That is how it happens. That's democracy. But when the time comes to actually help people to ensure that elections that nobody wants, but elections that could be triggered in a democracy, having that be as safe as possible, well, I certainly hope other political parties will support the passage of this bill so that if there were to be elections during a pandemic, these elections would be safer for Canadians. Thank you, Prime Minister. This is all the time you have today with us. Thank you.
All right, that is the Prime Minister of Canada on this Tuesday. I'll just make a point on his last comment there, which was around repeated attempts to try and get some legislation around safe elections during a pandemic passed. The Prime Minister, yes, says that he doesn't want an election, but he's also said multiple times, including to me in an interview, that if it becomes difficult to govern, i.e. to get legislation passed, then it might be time for an election. So that's perhaps a little different than not wanting an election. Let me bring in my colleagues Hannah Thibodeau and Evan Dyer just to go over a couple of the things that he had to say today. Hannah, why don't you start us off on what stood out for you there?
Yeah, I think the big thing is the Johnson & Johnson and the pause that we're seeing in the United States. He was asked specifically about this. What does this mean for Canada? Because Canada currently has signed a contract for 10 million doses of Johnson & Johnson to start arriving in the second and third quarters. And I asked Procurement Minister Anita Anand last week exactly when we will know what the delivery schedule is. She said it was supposed to be this week. We don't know now. The Prime Minister responding there saying that he hopes that we can still use those doses. However, they're monitoring what is happening in the U.S. And just remind Canadians what is happening in the U.S. There were 6 women who had adverse effects. It was blood clots. One of the women passed away because of this. There were 6 women, though. And remember, about 6.8 million doses have been administered in the United States. However, they are, out of abundance of caution, putting a pause on the use of the J&J vaccine. And here in Canada, still a lot of questions as to what will happen down the road. We know that Health Canada is keeping a close eye on the FDA, the CDC there, and what their recommendations will be. So that's kind of where people stand. A great question by someone who asked, if you are prone to blood clots, what would you advise them to do? And the Prime Minister being very careful there, of course, following doctors' orders and following the orders of scientists, not giving specific advice on that.
Yeah, so Health Canada watching it, and perhaps we could expect updated information based on what the FDA and CDC concludes. Evan, I also thought the Prime Minister just seemed to want to remind Canadians that things are very bad right now in large parts of the country and that it's important to take things seriously.
They are bad. At the same time, though, there is some good news in the data that was given by Dr. Tam and her colleagues, talking about the third wave being a big one. Well, there's no doubt about that. Actually, if you look at the 3 waves that Canada has had, we had lower than 2,000 average daily case count in the first wave. The second wave, we were at 8,000. We're already at 8,000 on the third wave, and we're still going up. In fact, we had almost 11,000 cases today, so that we can expect that rolling 7-day average to go up above 10,000. But when you look at deaths, you see that they've dropped from one wave to the next. So the first wave, we had 175 deaths a day. Second wave, you're down to 160. And as we just heard, the third wave is producing somewhere in the range of 30 deaths a day. So I thought that Dr. Tam, when she said that we are seeing an impact of vaccination on mortality, perhaps undersold the effect of vaccination, because we should also add into that equation the fact that the variant that's going around in the third wave is actually more fatal than we saw with the original COVID in the first wave. What's changed? Well, of course, the first wave was that long-term care wave. So older people made up a much higher proportion of the people getting COVID, and they are more susceptible to it. But vaccination has really taken the most vulnerable parts of the population out of the equation. And so that more than counterbalances the increased lethality of the new variants of COVID that are going around. And so while it very much looking at the caseload that we're going to see the third wave continue to build, I don't think that it's likely to get back to the daily death counts that we saw in the first wave or the second wave. And that is the effect of vaccination. But other countries around the world, and we heard them reference there in that news conference, Chile being the prime example, they took their foot off the brake. basically too early. And although they had one of the world's most successful vaccination campaigns, right up there with the United Kingdom, they experienced a very, very deadly wave of COVID-19. And so you can see that there is a lot of concern that this thing, if it is allowed to grow exponentially, could still kill large numbers of Canadians.
And in fact, one of the other points of data that Dr. Tam gave was in terms of the ICUs. It's gone up 24% based on last week. So you're quite right, and it is an important point, Evan, to point out that there are not as many deaths, but there are more people in hospital, and it is becoming problematic in many parts of this province, BC and Alberta, for the healthcare system to sustain that. I would note that as we were going on air, CHEO, the Children's Hospital here in Ottawa, saying that like Sick Kids Toronto, it also is going to take in some young adults to treat them because we are simply running out of beds. Okay, I'm going to leave it there, both of you. Thank you so much. I appreciate you doing this, Hannah and Evan. You'll see them throughout the day, I'm sure. And that is our coverage of the Prime Minister's address to Canadians around the pandemic today. Of course, we will continue our coverage on this and other stories with my friend and colleague, Suhana Marchand.
We'll now go back to the floor. First question.
Dr. Tam, I would like to get your thoughts about holding the Montreal Grand Prix